set up.
Feels like I should start singing.
Hi, good afternoon, everyone. Thanks for coming. So we had a news release go out earlier today, and my recommendation at that time was for people who have traveled outside of the province in the last 14 days to not visit hospitals, long-term care facilities, or personal care homes. Elderly residents or patients and those with a weakened immune system or underlying medical conditions are at a higher risk of developing complications from COVID-19. This is a proactive approach to protect the most vulnerable of our population. This is the beginning of social distancing. COVID-19 is a respiratory illness, and respiratory illnesses circulate in the community yearly. There are established processes in place to deal with this in our institutions. Anyone with cold or flu symptoms should also avoid visiting until their symptoms disappear, regardless of travel. We've been receiving some questions regarding sporting events and other large gatherings, and we would say that COVID-19 needs to be considered in event planning. Mass gatherings have the potential for increasing the spread of infectious diseases, and infections can be transmitted during travel to and from an event and in participants' home communities once they return. So we are actively monitoring the situation and are engaged with internal and external stakeholders with regards to advice on large gathering. And when and if stronger recommendations are needed, the public will be notified. Thank you. Any questions?
Do we have any more results back on the testing that has already taken place?
So we have received more. I think there's still about 19 outstanding results, and to date everything has been negative.
What about those companies that have now decided to get people to work from home, Johnson and Verifin, for example? Your thoughts on this?
So we have heard about that through the media, and public health is not engaged in those decisions. Those were decisions of the company themselves.
With the testing, how are you deciding who should get a swab and who shouldn't?
So at the moment, we're recommending that anybody who has traveled outside of the country, who presents with respiratory symptoms of cough, fever, shortness of breath, difficulty breathing, certainly be assessed to see if they need a swab for COVID-19. Anyone who, we are also expanding testing to anyone who is in emergency departments, that there's any swabs that are done for respiratory illnesses will also be tested for COVID-19, and we encourage anyone who's in hospital, patients in hospital who have severe respiratory illnesses, if the clinicians feel it's warranted for them to be tested as well as part of the laboratory surveillance.
For those working offshore, we're hearing that they're being screened before leaving or returning. Is this the case? Are we seeing more testing because of this?
So offshore companies have their own policies in place for how they will protect their workers on rigs. We have heard that many of those companies are instituting policies such as that, yes.
What about for elected officials here? What policies are we going to be seeing moving forward? Are we going to see the travel, I guess, that's already scheduled, or is the recommendation to stay put?
So right now, we're recommending that there be no travel outside of the province for government employees.
Will the Premier be quarantined when he comes back, or self-isolating, now that we know Trudeau and all these other federal politicians are?
So the requirements for self-isolation would be at the moment if you visited an area with increased risk for COVID-19 or a much higher risk. So right now those areas are Iran and Italy and Hubei province of China. If you've been in contact with a known case of COVID-19, you will be asked to quarantine even if you're feeling well. Otherwise, we're asking people to self-monitor, and if they have symptoms, then to self-isolate, and if they've traveled outside of the country.
What's the turnaround time been like in terms of testing?
So generally, once our lab here receives the swabs, they can do the testing fairly quickly, usually within a matter of hours. Depending if it comes in very late in the day, it may be the next day that they get the result. And then it gets sent out to the National Microbiology Lab. It's at least 24 hours to get there, and then it's about a 24-hour turnaround time from the national lab to get the confirmation.
So anyone who's swabbed should get a definite response within about, I guess, 3 days or so to allow for.
Generally speaking, weather, obviously this time of year, weather plays a role in that, but generally speaking, yes.
How many kits do we have available for testing? Do we have an ample supply here?
So we have test kits here that are available. Exact numbers, I'm not 100%.
You said organizers should consider COVID-19 in their planning. What does that mean?
So the events, large gatherings and events, obviously there are risk factors associated with that, and when there are large groups together, you can spread illnesses, especially respiratory illnesses, more easily. So there are, the Public Health Agency of Canada has a tool. It's a risk-informed decision-making tool for mass gatherings in the picture of COVID-19 right now. And so we certainly would refer people to that, and it gives an outline to how to do a risk assessment for your gathering to say, which gatherings are at higher risk, which are at lower risk. And those are things we all have to consider.
If someone was to test positive, what is the procedure in place to deal with that case?
So if we have somebody who tests positive, they would already be on isolation because they would be symptomatic, and we isolate anybody that we're testing. So they would be on isolation, and as soon as we have a presumptive positive test, we're not gonna wait for a confirmatory test to come back. We're gonna treat that presumptive positive as a true positive, and then we would do contact tracing, and we would make sure that we ask those contacts to quarantine themselves for 14 days after their last contact with the positive case.
I guess if they would stay in self-isolation, we wouldn't be moving them to a medical center?
No. I mean, if somebody develops symptoms that require them to be admitted to hospital, obviously that would have to happen. But if, we know a large proportion of the people who have this disease have mild disease and can be cared for at home. So if that can happen, that's what will happen.
I know it's the question I guess everyone's been asking, and many know the response to this, but what is the best way to be on the cautionary side of this for the general public to be doing in their daily habits?
So certainly wash your hands. Make sure you wash them very well, soap and water, work up a good lather, at least 20 seconds, got all parts of your hands. If you don't have soap and water, use alcohol-based hand sanitizer with at least 60% alcohol, and again, make sure you get all of your hands. Make sure you avoid people who are unwell, avoid large crowds if you can, and if you do have a cold, obviously, or respiratory symptoms, make sure you practice good cough etiquette, so cough into your sleeve or into a tissue and then throw the tissue away, and stay at home, really, if you're sick.
There's a local doctor who has a very widely read Facebook post that was put out just recently, and she's insisting everyone should stay home, every event should be canceled, complete and utter shutdown. And she's gotten several replies. What is your view on these sorts of posts? Is that helpful, or is it because it tends to contradict quite often the message that's being sent by health officials?
Right. So, I can't comment as to people's opinions, but what we are doing, we've engaged with the Public Health Agency of Canada and our provincial and territorial counterparts across the country. We are developing a cohesive approach to dealing with this. Obviously, as the disease moves across the country, different areas are going to have different things that they're doing, but we have developed approaches for dealing with these questions that are being put out there to make sure that we would do what needs to be done when it needs to be done and when it's appropriate.
How many people are in quarantine right now?
At the moment, there are 3 people, as of this morning, I guess, there are 3 people that may have changed depending on the regional health authorities if they've been advised of somebody who's been a contact of the case.
How many tests have we seen conducted so far to this date? I know yesterday was 44, I just don't know if that number's changed.
Yeah, it's a little over 50, I think it's 54 right now. Again, that may have changed, that was as of this morning, so, yeah.
What's being done in order to educate staff on the front lines, because this is new for a lot of them as well, And I've heard concerns, for example, from people who have been swabbed that the staff showing up were kind of confused themselves about what the process is they were supposed to be following and how exactly this was all supposed to work.
So all of our staff have been trained. There are special practitioners in healthcare systems called infection prevention and control practitioners, and they are responsible for educating staff on how to properly protect themselves, how to protect other patients and the public. Anytime something new is rolling out, there's bound to be questions and things that come up, and some things to work through as we get used to a new situation. But I think our public health staff are working tirelessly, and they're doing a great job.
There are a lot of people who have travel planned, especially in and around the Easter break. They're looking at it, and a lot of that is to areas that aren't on the government's list of places to avoid non-essential travel. What would your advice be to people who are trying to decide whether or not they should take that trip?
So at this point, I think people need to think carefully about travel, because this disease is spreading around the globe, and as we've seen in the last week to week and a half, it has changed dramatically in that time. And going away for a week, you could end up in a very different situation when you're ready to come home than when you left. So I think you really need to carefully consider what's happening in the world. You need to consider what your own health is. If you did contract the disease and you're in another country, would you be able to get the care you need? Would you be able to afford to get the care you need? What if you get quarantined when you get there? So these are all things that you have to consider when you're making any travel plans. And then when you come home, you might have to be quarantined again for another 14 days, depending. So these are things that people really need to take into consideration. And cruise ships, of course, right now, as you know, at the Public Health Agency of Canada has recommended that we really should not be traveling on cruise ships.
There's
What
a
is-
difference between quarantine and self-isolation. Quarantine is under watch, something?
So quarantine is a term we use to describe what we do when we isolate people who are not sick. So if someone does not have any symptoms of a disease, but they're a close contact or they've come from an area of concern, then we would ask them to quarantine themselves. When you're ill, we ask you to isolate yourself. So that's the distinction there. The term self-isolation has been used a fair bit because most of the people that we've had have been sick, right? But really, if people are well, then that's actually quarantine.
Further to Peter's question, particularly in relation to, say, Easter travel, a lot of families going away, kids going away. Is there a plan in place, say, should there be a case in a school? Does that mean that classroom doesn't go to school? Does it mean the school is closed? Is there a plan in place for that?
So those are all questions that we're working through and answering. Certainly it would have to be taken on a case-by-case basis, and it depends on, if the child was in school when they were sick, or if they were home and hadn't been in school, that's a different situation, right? So but those are all questions that we're working through right now.
When you deliver the flu vaccine, it's always a pretty difficult process to get it to, say, coastal Labrador, some rural areas. For testing purposes for this, how does it happen, say, if someone is sick in Rigolet or someplace like that?
So if somebody in Rigolet had traveled or had been in contact of a case of COVID, they would visit healthcare facilities there. They would get the swab taken if need be. That swab, they would then, if they're not sick or terribly sick, they would be asked to isolate at home. If it was felt that they needed hospital-based care, then that would be arranged. And the swab would then be sent to Goose Bay, and Goose would send it down here.
What do symptoms look like? We're seeing an increase in influenza right now in the province. How does the COVID differ from?
So they're actually fairly similar, which is part of the difficulty, right? So COVID tends to have fever and cough. More severe cases may have difficulty breathing. With influenza, you tend to get fever as well, and it's usually quite high. You feel very unwell, you have aches and pains, and you may get a cough with influenza as well. You may have some upper respiratory symptoms with both, probably a little more commonly with influenza. So they can be very similar. It is hard to tell. So right now, travel is the biggest risk, or exposure to a known case.
This weekend, thousands are going to be in pretty close proximity to each other for the next few days. Any special advice this particular weekend, or is it just the same advice still apply, precautionary advice?
Oh, Miss Patty's Day. I forgot.
It sure is.
So certainly our advice would be to wash your hands, wash your hands, wash your hands. Make sure that you stay away from people who are sick. If you are sick, don't attend mass gatherings. Practice good cough etiquette, and try to maybe think about all those things when you're having fun.
Are we seeing any cases in children or young children? I know obviously we have an older demographic, but there are still many parents with young children who maybe exhibit symptoms of influenza or COVID and then have a young child nearby.
Right, so children, we don't see a lot of kids, comparatively, if we think about influenza, with influenza we have lots of kids who get sick with it, and often kids are the ones who kind of bring it into the household, right? So with COVID, we're seeing fewer kids comparatively affected by COVID, and certainly younger kids seem to be affected less severely, although the risk of severity increases with age. But not to say that children can't be affected severely, but generally speaking, we're not seeing the same number of children who are affected by COVID as we do, say, influenza. But that's not a reason to sort of rest on our laurels and say we don't have to worry about it. We still should practice all the same precautions, even with kids.
Does the government have a threshold whereby they would take actions as they have in Italy and in the U.S.? Is there a number of cases or some other parameter that would make you decide to shut down events, close schools, that sort of thing?
It would certainly have to be, I mean, those things are in discussion, absolutely, but there would, it would have to be situational, because you may have a lot of cases, but if all of those cases are in clusters, you may not think, that may not be as bad as if you had a lot of cases that had community transmission. So the whole situation would have to be considered before we could make decisions like that, and we are not there right now. We have no cases. So.
Can we expect daily updates at this point, or are we still on a day-to-day basis?
We will certainly be given regular updates, and as often as we can, we will give those, but I can't commit to daily at this point. So.
Looking at what's happening across the country, like New Brunswick, kind of asking people coming back from March break not to go to school, kind of mixed messages, I guess, across Canada from different public health officials. So I guess what's the logic behind waiting to see where the clusters emerge rather than, is it in consideration whether there could be preventative, stay-home policies or something like that?
So I think, decisions get made based on the context, the local context. And so I can't comment as to New Brunswick's decisions and why they were made, but certainly we would take any of those contextual factors into account if we were thinking about making decisions like that. And part of that may be just looking at spread of disease in communities, or how many cases we had, those sorts of things. So at the moment, though, we're not there.
Anything else that maybe we haven't touched on that you would like to provide?
Well, I think we just all have to remember that this is a new disease. We haven't seen anything like it previously, so we need to all do our part. We all have a part to play to reduce the spread of this disease. Wash your hands, avoid large crowds. If you're sick, stay home. Certainly don't visit anyone who is in a vulnerable group, so the elderly, people with underlying medical conditions. If you are unwell, or if you've traveled to an area certainly outside of the country, and sometimes even outside of the province, if you were attending large gatherings, avoid for at least 14 days after you come back. I think we can certainly all work together to make sure that we reduce the spread of this disease.
A lot of universities are restricting travel on students, staff, and faculty for university purposes. Memorial's not one of them. There's no restrictions imposed at all. Does that give you cause for any concern? That's a big, big community, and if you get something going through Mon, that's a lot of people.
So I think Memorial certainly has a processes in place, that they're considering all of those questions as well. There's nobody out there now who's not thinking about these things, so, but, you know, and we'll have to take that as it comes, and you know, the government has set an example by asking workers not to travel for business-related purposes, and our health authorities, so, you know, I'm sure we'll be seeing more of that as time goes on.
Thank you.
Okay, thanks, everybody.
Are we?
So COVID is obviously, the virus itself is SARS-CoV-2. So it is a coronavirus, but when we
How much
think of
training? I did a
coronavirus,
3-year
there are
program.
right?
I just know that.
Yes, yeah.
No, it was here actually. I did it here. It was an interpreter program that set up here, and it was only wrong. Okay.
Well done, Damien, thanks. Okay.
And then, and then it just didn't run here again, but still, but I did it here in I graduated in 2000. Pretty much, right? Yeah, I know, it was not easy. Yeah, I know, it was good. Dad said, Dad watched the news yesterday, he said, "Nick, my arm."
Even if it was bad,
God love it. Alrighty.
But the web doesn't actually keep the line.
I'm not sure how they.
Thank you.
No, like you say, whenever we power up, what's that? No.
I need like a little red sweater for it. It's all over.